Welcome to this talk by Dr. Chris Kahlenborn on breast cancer and the pill. Who is Dr. Chris Kahlenborn? Dr. Chris Kahlenborn is a board-certified physician of internal medicine who graduated from Penn State Medical University in 1988 and has been doing research on oral contraceptives and breast cancer for the past 15 years. In addition to practicing as a hospitalist in Pennsylvania, he has lectured on his area of research in Russia, China, the Philippines, and Canada, as well as before the Federal Drug Administration in June of 2000. He is the author of the book entitled Breast Cancer, Its Links to Abortion and the Birth Control Pill. In addition, in October 2006, he and researchers from Penn State Medical University and the University of Pittsburgh published their findings in the Mayo Clinic Proceedings in a meta-analysis entitled Oral Contraceptive Use as a Risk Factor for Premenopausal Breast Cancer. This meta-analysis remains the most recent meta-analysis to date.
Let me just give you a brief overview over the next 20 minutes of how the birth control pill theoretically causes breast cancer and increases your risk. Because very few people appear to be aware of it, and as I'll show you later in the talk, there's a good reason for that. So, in the United States, these figures are a little bit outdated, but about 200,000 women get breast cancer every year, and about 40,000 die from their breast cancer. Many times you'll hear that breast cancer is rare in women under age 50, but it's really not. There's about 45 to 50,000 women who get breast cancer under age 50, so it's about 20% of all cases, 20 to 25%. Okay. There are a number of factors for breast cancer. One of the biggest factors is family history. The older you are, the higher your risk of breast cancer. If you've taken hormones, or if you have late menopause, or your cycle started early menarche. The earlier you have children, the lower your risk of breast cancer. And there's several other factors there. As you can see, the list kind of goes on. If you've been exposed to radiation, that tends to increase your risk of breast cancer, and probably an early miscarriage and induced abortion increase your risk of breast cancer. So as you can see, there are about 15 factors, and it's not that easy to show that the birth control pill causes or increases your risk of breast cancer because it's one of many factors. So why have breast cancer rates risen? In the United States, over the last 40 or 50 years, breast cancer rates have gone up between usually about 30 to 70%. And the rate of breast cancer, if you look at the charts, in women under 50, has gone up maybe only 10 or 20%. But that's because most of our data comes from the SEER, the Surveillance Epidemiology people in Washington, D.C., and their statistics really only go back to mostly 1975. But there's one state, Connecticut, that has statistics for women under age 50. And if you look at the rate of breast cancer, it goes up markedly after 1960. And 1960 is when the birth control pill was approved by the FDA in this country. So the rates in young women under age 50 have gone up about 50% in the last 50 years. We have to ask ourselves why. Women are having fewer children. The more children you have, the more protected you are for breast cancer. Every time you have a child or breastfeed for 6 months or more, your risk of breast cancer and ovarian cancer go down about 5 or 10%. So I tell people, if you just have 10 children, your risk is pretty much zero. Okay, women are breastfeeding. I don't know if it's picking up more than before, but there was a decline for a number of decades, and since breastfeeding protects you, the rate of breast cancer seemed to increase as women breastfed less. Induced abortion is another subject. That tends to increase your risk of breast cancer. And the birth control pill. So what is the birth control pill? It's a combination usually of two hormones, and they synthetic. So they're not, your body makes progesterone and estradiol, natural hormones, but these are usually synthetic hormones. And how do they work? They suppress ovulation, although a recent paper I read from Canada shows that the lower dose birth control pill, you're still ovulating 15 or 20% of the time, pretty high rate when they look at ultrasounds and they look at hormone levels. So they don't suppress them as much as the older types. They thicken cervical mucus, and they change the lining of the endometrium to make it thinner. So when women are put on birth control pills, usually their menses decrease in volume, and that makes sense because the lining of the endometrium is thinner. So one of the ways they probably work is causing an early abortion at times, although it's difficult to measure how often that happens. Just a quick overview. I won't go into all these slides, but the birth control pill increased the risk of breast cancer in rats and dogs and monkeys. So that was in the 1960s, 1970s that these studies came out. And there's a pathologist named Anderson in 1989 who noticed that if you take the birth control pill, your rate of breast cell division goes up. So why is that important? All of our cells are dividing and maturing throughout our lives, except basically our nerve cells. So your skin cells, your intestinal cells, and the breast cancer cells also, they divide and mature. And every time through your monthly cycle, as the levels of hormones and progesterone goes up in the luteal phase, they divide and tend to mature. So what happens when you get put on the birth control pill is, I don't know if I have a pointer here, but if you could see on your left is the early part of the menstrual cycle, and in the green is how fast your breast cells are dividing. And in the late part, the luteal phase, in the green is how fast your breast cell divides. So your breast cells divide more quickly toward the end of your cycle. The pink shows what happens when you're on the birth control pill. And they increase the rate of breast cell division. So does anybody remember the I Love Lucy version when Ethel and Lucy are making chocolates and they start having to put the chocolates in their shirts and they can't keep up? Well, they're going to make some pretty bad chocolates because you can't speed up an assembly line. So in the same manner, our bodies were designed to work in a certain way, and if you speed them up, you're going to get what's called a DNA error. And that error is a cell waiting to become a cancer cell 10 or 20 years later. So birth control pills probably cause breast cancer because they speed the rate of breast cell division, and it's possible that they cause early abortions, and even in early abortions, the hormone levels are starting to go up. And if you have an early abortion, even in the first week of life, the hormone levels drop, and that's called a hormonal blow by researchers. I don't think that's how they cause breast cancer, but that is a possible mechanism. Okay. Now, they're animal models, and we have a theoretical model, so we have to ask ourselves, how come nobody's heard of this, and what do the studies in humans show? And basically, all of the medical associations have consistently said that the birth control pill is pretty safe. And if you read, from ACOG, they pretty much say it's a good thing. Wouldn't you agree, Mike? I mean, every time I read about it, it's like the greatest thing since sliced bread.